So we have complex trauma, we have single incident traumas. But let's start off, generally speaking, what's your understanding of what constitutes trauma?
Yeah, I think that's a really important question because there's too much mix-up, and I think it's very important for us as clinicians, researchers, to make the distinction that you're asking for. I think a trauma is an event that overwhelms the central nervous system and changes the way you remember and react, and remember and react basically to things that remind you of it. But trauma is a trauma. It's something very bad that happens to your central nervous system, to your mind, that you are incapable of assimilating, of taking in and integrating into your life. So it's about a very bad event. What we see in our practices much more is not a particular trauma, but what we see is an environment that was not responsive and where people were not there to help you to manage life in general. So the whole issue of abuse and neglect tends to be rolled into the PTSD phenomenon. Mm-hmm. And that is, we have talked about this many times before, the issue of disorganized attachments and living in an environment where nobody sees you and nobody helps you to cope with the reality of life is really a very different experience than getting hit, beaten, or raped. If you live in an environment where people don't see you and don't protect you and where you don't feel seen, the chances that you have multiple traumatic incidents sharply increases. So you may also have PTSD symptoms, but the result of growing up in an environment where you're unseen and have to fend for yourself rather than interpersonally being seen is very different.